a respiratory illness with the flu-like symptoms similar to COVID-19 scare back in 2020 in China has raised health concerns globally, but with particularly India, where in fact sirens have also been sounded, with countries closely monitoring the situation. Photos and videos of people wearing masks in hospitals in China have emerged on social media platforms, signaling the outbreak getting worse. Beijing has issued a press statement to address such concerns days after these viral pictures and videos have raised concerns in the worldwide. China's foreign ministry spokesperson Mao Ning has said that respiratory infections tend to peak during the winter season. Meanwhile, India has upped its vigil a notch following reports of rising cases of respiratory illnesses in China, even as it has asked WHO to share timely updates regarding the situation in China. According to the Union Health Ministry, a meeting of joint monitoring group was held under the chairmanship of the DG of Health Services to deliberate the current situation in the view of this outbreak similar to that of COVID-19 in China at this point of time and the urgent need to put the emphasis on the preparedness back home. Now viewers, joining me for an extensive conversation on in fact what India needs to do and how India needs to be prepared at this point of time is Dr. Sanjeev Chaubey, who is the MD of Internal Medicine in Shanghai in China. Thank you very much for speaking to us and appreciate you giving us your time at this point of time. Doctor, at this point we are looking at these reports. That is the least that we have at the present scenario. But what is the current response of in fact the healthcare system back in China to these reports that are coming at this point of time, signaling a huge cause of concern for people traveling between these nations and also back home in India, where there are preparations already been underway?
See, this is actually outgoing for the spread of this virus from the October itself. So October, November, and December. And since the winter is in the peak, uh, its HPMV virus is actually spreading quite well in the northern region of the China. But since there is no direct flight from China to India at the moment, uh, so it's least likely. But our CDC and even the WHO, both of them, they're having a close monitoring. We are actually panicking because the symptoms are more similar like a COVID, but actually it's not a COVID. And we are having, actually, even in the hospital, we are having this result. So this is RSV, influenza A, B. As such, there is no positive result has been shown, but the chaotic situation is we can see in the public hospital, and people are now making, even one, because the transmission of the mode of transmission is same like a COVID. So if one people get sick in one house, so all of them get affected. So they all rush to the hospital. So that's why there's overcrowding you can see, and so that our main concern is to basically keep the close watch on the situation, and we'll see in the future if it's come, then of course we have to prepare. If not, then it's okay, just like a flu, it will go.
Doctor, but the reports signal the highlight on the upward trend of the HMPV virus that is specifically being traced more in the children below the age of 14 in the northern provinces of China. So it is also
Right.
being very concerning for India. Overall, if at all, it is not concerning for the COVID-19 scare or the situation like that. But at the same time, the report suggests the upward trend of transmission in children below the age of 14. How do you respond to that, and how worried should India be?
It's not 14, even the less younger children, even 8 or 7 year old, having the flu symptoms, which is commonly seen, and old. elderly patients like 60 or 65 plus, those who having a comorbid condition. So the medical scientific reason behind this is simple, like the immunity, because the children are still in the vaccination phase, so they are still developing their immunity. And the older people, those who are having a means other problem like high blood pressure, diabetes, and all, so they are also losing immunity in the older age. So the both uh, age group are in the risk. That's the main concern. So, of course, we need to start the vaccination, the one which as a precautionary, and we have to start the just like follow the like every year in this time we used to follow our uh, COVID protective measures like frequent hand wash and masking. That's precautionary. As such, there is no advisory or guideline has been issued, or neither any emergency has been declared yet. But for the precaution, we can, yes, be alert.
So, in your view, in such a situation, as a precautionary measure only, should there be the constitution as on the basis of the government health ministry, the constitution of a committee to look after specifically the preparedness for this transmission, given the fact that India did learn from the lessons of the past in COVID-19, so as to minimize the transmission as much as possible?
Yes, of course. India also, not only India, the whole world. Actually, if you see just past the 3 years, it was just like lockdown. It was complete lockdown. The world was stuck everywhere. So that panicky situation was seen by everyone, not only India. So I don't think so. All the countries having a close watch on the China and the routes. That's why some of the flights are precautionary. They have cancelled, and some internal. They don't say anything publicly as if now, but of course, there are some precautions has been already taken by the other countries. They prepared. So we have enough resources in India. We have enough resources to handle and tackle this situation now, because we already have the same population of like China and India have almost the same population, but our medical
Doctor,
structure is quite
what
better.
also is a cause of worry is the travel restriction. Should they be put in force at this point of time, or is it too early to restrict the travel or to impose such restrictions, given the nature of transmission that is still not so known back home?
So that's the one problem with this virus, which make it different from the COVID is normally it is asymptomatic, means that is patient will just come with the complaint of body ache, back pain, very irrelevant symptoms, which is nothing. Normally, COVID was known for the respiratory. Even any virus during the winter time was responsible for this respiratory symptoms like flu, like running nose and cough, cold, sore throat, and all. But this virus having a different presentation in the body. Now, coming back to your question, Chinese New Year is coming. So again, it's a matter of concern because it will be spread, especially during the Chinese New Year. The foreigners as well as the locals, they prefer to travel all over the world, and that's one way to might be it is spread in some pockets. So definitely India also, I think, should prepare in coming days. Especially they have to close watch on the flights from the Hong Kong, Singapore, Vietnam, and Thailand.
So you're saying, Dr. Chaubey, that travel restrictions should be mulled upon. And also at this point of time, we are learning that the Telangana Health Department has issued a statement addressing concerns about a reported outbreak of HMPV in China. DGHS and the NCDC have clarified that HMPV is a respiratory virus causing flu-like symptoms, particularly during winter, and primarily affects the younger and the older age groups. Officials have confirmed that no cases of HMPV have been reported in Telangana to date. But this is what we are learning, Dr. Chaube, after in fact the Kerala Health Minister has also issued the advisory and taking the consideration of this very outbreak. Now, the Telangana government has also taken up the consideration of these reports, acknowledging that the state level preparedness and the administration in fact being aware ahead of these cases potentially being traced in the state should be prevented. So my last question in fact remains to be that as it has been observed as something potentially harmful, like we all have suffered back in COVID-19 during 2020, what remains to be the first priority for the states to be put in perspective so that at least at the localized level the transmission could be contained?
Actually, nothing. Just we have to close keep watch on the airport, because it's always, the transmission is coming from the travelers. So we have to keep close watch on the airport, and if possible, if you're suspecting that if the temperature sensor is showing fever, then it might be isolate and then just evaluate if it is okay, and then you can enter, or you can issue some kind of barcode like in future. So this is what the advisory is, because this virus is not in India yet. So but there is a high chance, because now many people, many Indians already have booked their ticket for the vacation, and this is how it enters through this is only the mode of transmission. Even the first few days people are asymptomatic, and after just changing of weather into the from China to India, it might be they become symptomatic, and they spread. So that's the one reason that we have to be very careful and keep watch on airport and flights also. If you suspect, just keep them isolated and just thoroughly check, and
All right.
that's the way that we can prevent ourselves.
All right, Dr. Sanjeev Chaube, thank you very much for speaking to us and giving us your time on the inputs regarding the scare for in fact the HMPV and the preparedness over the kind of the actions that needs to be taken by the country at this point of time. Thank you for joining us.